In other news tonight, the Philippines remains free of the deadly Middle East respiratory syndrome coronavirus. This is based so far on results of the medical tests conducted on passengers of the Etihad flight that brought in a male nurse who had a contact with a Filipina who died of the MERS-CoV virus. More from Freddie Abando.
Contact tracing of 414 passengers on board an Etihad flight which arrived at the Ninoy Aquino International Airport last week is in full swing. With the support of the Philippine National Police and the decision of the passengers to come forward, the Department of Health, led by Secretary Enrique On, has been working round the clock, conducting tests to determine if any one of them have been infected with the Middle East respiratory syndrome coronavirus, since one of the passengers and nurse exposed to a Filipino who died from the said virus tested positive as reported by UAE health authorities. All government hospitals nationwide were mobilized for this health alert. In Metro Manila, San Lazaro Lung Center and the Research Institute for Tropical Medicine have their hands full in initiating the lab test. The Research Institute conducted 221 lab tests. 64 passengers were admitted. 27 are being. To date, all tests revealed not one has been infected with the MERS coronavirus.
All the results that have been out are all negative. So, but then there are still some specimens that needs to be processed. But currently the trend will be on the negative. Well, all the DOH retained hospitals have been mobilized to address this issue. And they're up on their toes in admitting patients or in quarantining possible cases of MERS coronavirus.
The MERS coronavirus is a fatal disease accompanied by flu, coughing, and even diarrhea. It was first discovered in Saudi Arabia by Dr. Saki, who isolated and identified a previously unknown virus from the lungs of a 60-year-old patient with acute pneumonia and renal failure. So far, the World Health Organization has been conducting widespread research for a cure. In the meantime, the Bureau of Quarantine continues its monitoring of the entry of incoming passengers Middle East in all international airports of the country. The good news, not one passenger has been registered positive for the MERS coronavirus.
Basically, what we're doing is has been evaluated by WHO and has really passed the standard of WHO. So when we talk about if we're at par as far as the testing is concerned, we are. We can assure you with that. And the WHO has been continually doing monitoring as well of our capacity in diagnosing not only MERS coronavirus but other emerging infectious diseases. And well, I'm glad to say that we have not really failed as when we talk about quality assurance is concerned. The way to go here is as when they get to enter an international airport, the only way that we will be able to detect them is when they show any manifestations as they enter the country through our thermal scan. But then we do provide them with a health checklist that will help us out as well in making sure that there are no other manifestation symptoms that will be present to our passengers.
For the People's Television Network, this is Freddie Abando reporting.